This is Dr. Tony Nolly here, talking to you regarding your home blocking setup. Today's position we'll be talking about is something called anterior L5 or increased sacral base blocking. This blocking setup is designed to use for about 20 minutes, so this is not a position that you would sleep in. However, sometimes your doctor could prescribe it for you to go longer than that. The blocking setup is pretty simple. You can use one of your wedges, and this fat part, or the large part, is be facing down towards your feet. It would be just like this in the lower part of your tailbone, and then you're going to be using your appropriate cervical roll. So this one I'm using the most common, which is going to be the large medium, but if you have a small medium or if you have a firm one that you're using, that's the one you would use. And that one's going to go, of course, going to go on your cervical spine just like this. To get set up properly, it's kind of a two-part position, so we're going to get her neck kind of set up properly so she comes down, sets her neck up. And the easiest way to get this on there is to go ahead and lift up your hips, and you put it right on your tailbone, just like that. And what it's going to do is going to rock your hips. Most people tend to like to have their legs bent. You can have your legs straight, but it tends to be less comfortable. And the idea is that you lay just like this for about 20 minutes, and it's going to rock your sacrum or your pelvis in this direction. You can also do an exercise while you're on here, some slight contractions. You can actually contract your abs and try to push your lumbar spine flat down to the table. So go ahead and do that, kind of push down, just like that. Kind of push your lumbar spine or your low back flat, hold it for 10 seconds, and then you relax. Good. And you can repeat that over the 20-minute period of time that you're laying on this roll. This is a very powerful setup to help reduce some low back subluxations, and it's something I definitely use a lot. Just make sure you follow your doctor's prescriptions to the appropriate cervical roll and the time that you should be doing that.